back in 2016, the Manitoba PC government came in saying that they were going to fix healthcare by cutting costs. Over the next few years, we saw Winnipeg ERs close, quick care clinics shutting down, and ICU beds being reduced, and more than $1 billion in planned projects in healthcare being canceled. We then saw wages freeze, workloads explode, and nurses start to burn out. Now, for every 100 young nurses that enter the field, only 58 stay, one of the worst records in the country. Vacancy rates have now hit 21%, and hospitals have turned to private nursing agencies as a band-aid, spending $80 million in 2024 just to keep the lights on. In 2023, a new NDP government came in promising to rebuild the healthcare system. They've added $1.2 billion to healthcare spending, which is a 14% increase. They've hired just under 1,300 new workers and started cutting the province's dependence on private nursing agencies. Here's the problem. Despite running a record $1.6 billion deficit this year, the system is still in crisis. ER waits are stretching to 13 to 19 hours, which is amongst Canada's longest wait times. Critical incident reports show 24 patient deaths in just 9 months, many from delayed care. 1,000 allied health positions still remain vacant. Now, this new NDP government is blaming things like wildfires and the tariffs for why they're running a record $1.6 billion deficit, by the way, which doubled from $794 million to the $1.6 billion in 1 year. Critics are asking them, if you're willing to run a record deficit, why aren't you putting more towards the frontline healthcare workers? Healthcare, yeah, it got an increase, but the system needed a complete transfusion, not just a band-aid. In my mind, the truth is that both governments share responsibility. One gutted the system, the other inherited the wreckage, but so far hasn't really done anything to try and fix it. And while we have politicians debating budgets and blame, ordinary Manitobans are the ones that are paying the price in pain, in fear, and in hours spent waiting in the hallways for care that should already be there for them.